the Chief Executive of the Community Pharmacy Thames Valley. He will be explaining a bit about what that is and talking about Pharmacy First as well, because the Pharmacy First service is coming up to, I think, the first year of being in operation. So we're kind of eager to hear about how that's going. We are recording the session, so if you do not want to be on camera, you don't want your face to be seen on camera, please do switch your camera off so that it doesn't show up in the recording. I think we will, let's make a start. There'll be an opportunity for anybody to ask questions at the end of the presentation as well. So we welcome those. Over to you, David.
Well, thank you very much. And thanks to Zoe and to Fiona for inviting me to your meeting. I'm David Deavn. I'm the Chief Officer of Community Pharmacy Thames Valley. And I want to use this opportunity today to sort of talk you through who we are, what pharmacies can and can't do, and then go into a little bit of detail around Pharmacy First, which is a brand new service that was introduced on January the 31st, 2024. So it's nearly its first birthday. So who is Community Pharmacy Thames Valley? So we're a statutory organisation. It's a non-profit. We're set up by an Act of Parliament to represent all the pharmacies, all the community pharmacies within a geographical region. And we cover the whole of Bucks, the whole of Berkshire and the whole of Oxfordshire, which is about 324 pharmacies as of Monday, because we had a new pharmacy open on Monday in Oxfordshire. So what we do, we work with all the local authorities, the ICS, public health, patient groups such as yourselves, GPs, trusts, several other providers who are commissioned by different organisations to really get the best out of pharmacy for the local community. Number one, to make sure that pharmacies deliver what they've promised to deliver and support them in delivering it. So we organise training and we keep them within the rules of what we have to do. And we also negotiate new services for our contractors, those that hold a pharmacy contract within our patch, to deliver services going forward. There's only 2.5 employees, so we're not an enormous team. That includes me, and a tiny bit, a fraction of a penny is taken from every single prescription that goes to support the LPC. At the end of the day, pays my salary. But we're not a company. We don't sell things or buy things. We're just here to exist for our members. So currently, as it stands today, there's 85 community pharmacies in Buckinghamshire. So they're your normal, the ones you see on many high streets and in many suburbs. 3 of those are what used to be called 100-hour pharmacies. So the government made a change in the rules, 12, 13, 14 years ago, which enabled you to open a pharmacy wherever you liked, as long as you promised to open 100 hours. But post-pandemic, the government's changed the rules again to allow those 100-hour pharmacies to only open for 72. So you've got 3 of those within Buckinghamshire. You've got Consult in Aylesbury, Q2 in High Wycombe, and the big Tesco's in Buckingham. And out of that 85 pharmacies, 2 are what we call distance selling pharmacies or internet pharmacies. So again, they work on a slightly different rule book. They're not allowed really to encourage patients to enter the pharmacy and to have that normal interaction as like a normal community pharmacy. But what they're supposed to do is if they get any prescriptions from anywhere in England, they have to deliver free of charge that prescription to that customer or patient that's come through to them. That's part of the promise they make when they get their contract. And you may have heard of some of the bigger online pharmacies that are based in other parts of the country, such as Pharmacy to You, Boots Direct, Chemist for You. There's quite a lot. And they also tend to do quite a lot of private stuff as a sideline as well to pay the bills. So what do pharmacies do? Well, what what we've done, the government's done, is categorise 3 types of services. So there's what's called essential services. These are the things that if you want to open a pharmacy and you pass all the other checks that take place, you have to dispense. Sounds obvious, but that's what you have to do, including repeat prescriptions. You have to be able to take in old medication or unwanted medication from patients, not from businesses, but from normal patients. We also promise to review as a certain list of medicines that if you're brand new to, we will do a review and make sure that, you know, you're comfortable with what you're taking, you know how you take it, and all the safety checks are implemented. We also have a contract that enables us to look after patients that are discharged from hospital, especially those that come out with loads of medicines. And we work with their GP to make sure that patient, again, follows the regime of medication they've been given. And we find that reduces readmittance to hospital down the line and saves many hundreds of thousands of pounds for the NHS. We're also there to advise patients on and signpost them to lose weight, stop smoking, reduce their alcohol intake, sort of lifestyle choices. And we also have a contract with the NHS to make sure that anyone that comes in for advice is offered what we call self-care, so can make the choice to buy something over the counter, whether it's cough medicine or something for your hay fever, and again have to give that advice to a patient completely free of charge. Then we have what's called advanced services. So these are optional from the pharmacy. They include Pharmacy First, but we find that 98% of all the pharmacies in the country are signed up for that because it's such a good service. Then we've just started a new oral contraception service where women can go in and we can initiate oral contraception or continue their normal prescription without having to go to the GP. We're also tasked with taking blood pressure readings when anyone over 40 that walks into a pharmacy that hasn't got pre-diagnosed hypertension, because apparently there's 5.5 million people that don't know they've got high blood pressure. So we've been asked to do all those blood pressure readings, send the readings to the GP, and then onward referral to hospital or whatever. We've also been really good, I think, in pharmacy delivering flu vaccinations now for 8 years now. And of course, we were at the forefront alongside our colleagues in general practice and PCNs to deliver the enormous COVID vaccination campaigns that have taken place. And over half the pharmacies now in Buckinghamshire are able to deliver COVID vaccinations when the appropriate season arrives. And we're also there to give out free lateral flow device testing kits to a very limited list of eligible patients. Then we have local services. These are the ones that are contracted to us by the system or by public health locally. And in Buckinghamshire, we have a morning after pill service for those women that need it. We work with Healthwatch Bucks to help patients recover from drug addiction. So we help them with methadone substitution. We also have a needle exchange service where anonymously patients can exchange dirty needles and get clean ones, because we find that saves countless lives. We run a palliative care service to give access to patients, Macmillan nurses, care homes, hospices, to get emergency supplies of palliative care when end-of-life care is needed. We're also issuing Tamiflu and COVID antivirals for outbreaks. We had an outbreak in a care home in Buckinghamshire on Christmas Eve, and the pharmacist worked all Christmas Day to make sure that all the residents in the care home got enough Tamiflu to counter the outbreak. And we're also lucky enough in Bob, including Bucks, obviously, that we have a minor ailment service. So for quite a small range of over-the-counter medicines, if that patient can prove they're on low income, it's a very simple checklist, they can get some over-the-counter medicines free of charge. There's about 20 pharmacies, I think, in Buckinghamshire that provide that service. All these services, all the details are available on our website at cptv.org.uk. But that gives you an overview of all the different things that pharmacies can do. So lots and lots of different things, probably more than you thought we did. So now I'm just going to play a very quick animation. It's about 1.5 to 2 minutes that our parent body, Community Pharmacy England, put together to help patients understand what Pharmacy First is. So hopefully you get the sound as well, but there are subtitles just in case. So let's get going.
Do you know about Pharmacy First? It's a convenient, free-to-access NHS service that means you can get healthcare advice and treatment directly from a pharmacy without needing a GP appointment. Pharmacists are able to provide walk-in or online consultations, and where appropriate, they can supply NHS medicines for people in eligible age groups with 7 common conditions: sinusitis, sore throat, earache in children, infected insect bite, impetigo, shingles, urinary tract infections in women. You can access Pharmacy First by walking into or contacting a pharmacy, or your GP surgery, or NHS 111 may refer you to the service, giving you faster access to healthcare advice and treatment. Pharmacists are experts in medicines and minor health conditions, with the skills to identify when medicines are needed. The Pharmacy First service helps take pressure off other parts of the healthcare system without impacting the quality of the care you get. Consultations with the pharmacists are private, and information on the consultation and any advice or treatment you receive will be added to your GP record. If your pharmacist can't help, they will send you to the right place, such as your GP surgery or an emergency department. However, previous experience suggests this will only be needed in a minority of cases. Over 95% of pharmacies in England, including both local and internet pharmacies, provide the Pharmacy First service. With easy access and expert guidance, Pharmacy First is here to help you get fast, effective care. Think Pharmacy First.
Hopefully you found that quite useful. It's quite a nice, how do I get the slides to move on there? Bear with me. Need to be changing the volume. How do I get out of that?
Do you know about Pharmacy?
There, sorry. So you may have seen from that little animation it's mostly around the 7 common conditions that you can walk in or get referred to as a patient to get looked after. And you may end up with prescription strength medication. But there's actually more to Pharmacy First than that. So you may have heard the service called Urgent Medicines Service, which is basically if you run out of medication on a repeat prescription, all you have to do is contact NHS 111, either on phone or through the website, and they can send you to the right pharmacy to get an emergency supply of that medication. You normally get 7 days supply. Before that, you'd have to go through your doctor and get phoned through, and it would be a right muddle, to be honest. But this is a far more streamlined system now, and almost half of all the consultations we do for Pharmacy First are for urgent medicine, which is obviously quite important. If you go on holiday and you run out of an inhaler, it's really important you get access to that medicine. And alongside the 7 conditions that was talked about there, GPs can actually refer a patient for almost anything that's considered a minor illness to a pharmacy. So anything really from a dodgy ankle to a basic skin rash, or something that may be considered minor in the eyes of the referrer from the practice. And I think the next slide, let's go down. On this slide here, it sort of highlights a lot of the things that you can be referred for by the practice. And we find this is one of the things we need to be better at. We find that some of the practices only tend to refer the 7 conditions on the left-hand side and forget about all the other ones. So even things like if you're finding difficulty to sleep, you can be referred to your pharmacy for, it wouldn't be a prescription strength treatment, but there's many treatments available over the counter, or it could be just advice that you need from the qualified pharmacist to help you recover quickly from your minor illness. So just going back then to Pharmacy First in Buckinghamshire, You can see from this sort of basic bar chart how many pharmacy firsts have been delivered in your part of the world. So most of the consultations that we're giving to patients are for those 7 conditions. And most of the patients that receive those consultations are walking in basically off the street or being directed there by another healthcare provider. Before the patient gets to see the pharmacist, however, they have to pass a series of, it's called a clinical gateway, almost like a series of questions that you get asked by the healthcare assistant. Then once it ticks all the boxes, you then qualify for that consultation, you get taken into the consultation room, and then you may end up with prescription strength medicine, or you may be referred on if a red flag pops up to another healthcare provider. So that's the majority. And as you can see, urgent medicine supply in yellow is a significant number of our consultations. And in blue, they're all the minor illness referrals that can be referred in by NHS 111 or by your GP practice. And that, to be honest, that if you look at the numbers in March, April, May, they were bigger than they were in October, November. So despite what we call sort of winter pressures, the number of referrals coming in has gone down, which is we see as an opportunity. We've seen the numbers in December and they've gone up slightly, but not enough as you'd think they should. When many patients struggle to get an appointment at their GP. And this next slide just really outlines again the percentages of consultations that come in from all the different areas. Right, so why do we do pharmacy first? Well, for GPs, it's obviously a great way to release capacity, to enable them to see more patients, or different patients, or those patients that maybe struggle to get to see their GP normally for other conditions. And of course, for those patients with more complex conditions, they can get longer appointments. And we've seen a couple of surgeries where they've gone from 10 to 15-minute appointments because they've released capacity of patients to the local pharmacy. Now, in pharmacy, for many pharmacists, this is the most exciting thing that's happened in the pharmacy sector for a long, long time. Pharmacists are extremely highly trained professionals. They go through a mammoth degree at various schools of pharmacy. We've got one in Reading, as it happens. They have a whole year alongside a registered mentor pharmacist to help them through sort of the practical skills within a pharmacy. And they all have to register with the GPHC, the General Pharmaceutical Council. So they are monitored very, very closely on their professional diligence and governance, and they have to do ongoing learning to keep up, like a register, to add points up to make sure they're always sort of at the forefront of any knowledge that comes out in the industry. But we found as well that Pharmacy First has been a bit of a lifeline in terms of financial viability. It's given pharmacies a little bit of extra income to keep paying the bills. And obviously we're all aware of the cost of living and the budget increases for employers in April. So this helps pay the bills. And of course, it's about building up relationships within the community. Across the whole of the Thames Valley area, we dispense 2.6 million items a month for patients. Half of those items are collected. So you can imagine how many patients visit a pharmacy every single month. And if we can build those relationships with those patients and look after their health for minor illnesses, that sort of, again, alleviates pressures in other parts of the healthcare sector. And then for patients, obviously, it enables you to get quicker appointments, bypasses the 8 o'clock flurry to get an appointment at your GP. And we know many GPs struggle to offer appointments for minor illnesses on the same day, and sometimes you have to wait 2 weeks. And we know the results from the treatment that patients are getting, people's quality of life have been improved. So many women who suffer from UTI have been able to be at the door of a pharmacy at first light, basically at 9 o'clock in the morning, to get treatment, rather than take time off work or wait for the kids to dropped off and have to go to their GP and try to get an appointment. And we found as well, there's been many studies about the antibiotics that pharmacies have been giving to patients as part of the treatment, they are far more compliant at giving out antibiotics and giving the right number of days course than many other healthcare providers, because they work to a legal framework. They're not allowed to go outside of it at all. So they're very, very tightly controlled. So it's worked quite well, I think, for all the three areas around Pharmacy First. So what have we learned in the first 11 months? It's not been perfect, you know, things need to improve. Bob and from that Buckinghamshire, we now have what we call pharmacy PCN leads. We've got a lead pharmacist for each PCN that works in community pharmacy that helps try to build the bridges with practices. We're trying to have great conversations with GP practices about how we can enable them to deliver more Pharmacy First referrals and trying to get them to use the right processes. What's been really difficult for us is to make patients more aware of the service. There was a national campaign quite early on and another one fairly recently, but they haven't actually landed very well at all. And we know that practices have advertised the service and so have pharmacies, but not enough patients actually know the service is there. And the NHS really needs to work harder and better at getting that message out. And we know that this service is essential to get through the peak demand times, but not every practice is as engaged as we'd like them to be. So we're working very hard with our contacts at the system to try to get practices to really do more referrals, and some of them don't, unfortunately. And some of the practices just say, well, just go to your pharmacy, but that doesn't work because it needs to be referred properly. So there's an audit trail for that patient. And as it said in the animation, once the consultation is over, whatever happens goes back into your GP record, which is essential, because if you keep going back for the same ailment time and time again, your GP needs to be aware of that, because there may be something else that needs looking at. We're also trying to get the out of hours and emergency care providers to work with it as well, but they, you know, typical NHS, they all work on different IT platforms and it's really difficult to get them to get up to speed, but we're working on that. And we're also working very closely with our system to make sure that GPs are referring. And the very last slide, I just wanted to share with you the current challenges in pharmacy at the moment. And you may have seen some of these on various news reports over the last few months, but with the exception of perhaps providers like Tesco, Asda and Boots, 3/4 of our pharmacies are owned by independent owners, and 90% of all their income comes from the NHS. So we're dependent on the quality of our contract with the NHS. Unfortunately, our contract with the NHS expired last March and it's not been renewed. And we're struggling to get the government to agree a new contract because it's been the same level for 7 years. There's been no increase in the contract whatsoever for 7 years. So what's happened in the last 7 years? Well, real-time costs have gone up 30%, but pharmacies can't put the prices up. They have to continue to deliver prescriptions at a loss, basically, in some parts of the Buckinghamshire. And believe it or not, for every prescription a pharmacy puts together, they get paid less than the price of a postage stamp. They get paid £1.27, and that pays for everything. They have to pay for their own premises, their own energy bills, their own computer systems, everything. There's no subsidy at all from the NHS for any of the infrastructure within pharmacy. So that's meant over the last 3 or 4 years, 7 pharmacies a week have closed in England. I think you've lost 10 in Bucks in the last 2 years, and that will continue to happen unless something changes. Alongside that, I won't blame it on Brexit, but it is one of the contributory factors, is that supply chain is in crisis. To get hold of some brands and makes of medicine is horrendous. And some pharmacists are spending a whole day a week trying to find it for patients who, you know, for certain conditions, it can be quite desperate, to be honest, and that doesn't help. And sometimes we can buy medicine from a wholesaler for £30, say, a box, but the government's only given the pharmacy £5 a box back. So we dispense at a loss for some lines, which we've raised with local MPs and local government. And due to that, and because of the lack of a contract, some of our independent members now are considering taking what we call collective action. So it's not a strike, but it's to stop doing some of the things that they've been doing for a long, long time for no funding whatsoever. So free deliveries may disappear, dossett boxes may be reduced, and as part of their pharmacy contract, they only have to open 40 hours a week, but many open more than that, and they may have to reduce to the core 40, which would be quite bad for some patients getting access to a pharmacy on a Saturday morning. So we've been working really hard as an LPC to work with local MPs, the ICS, and through our national body to try and raise the alarm, to be honest. But at this moment in time, our negotiating body, Community Pharmacy England, haven't even got a date to sit down with the government to negotiate a contract, which is, 10 months expired, basically. But we continue to do what we have to do because we've got to keep the lights on. So that's it from me. So I'd love to get any questions from yourselves, from those in the room. So I'll stop sharing so I can see all your faces.
Thank you, David. That was really interesting. A really good insight into how pharmacies work as well. So thank you. Does anybody have any questions for David?
Can you hear me?
Yes. Hi, Bal.
Hi. I'm Bal Chauhan. My name is Bal Chauhan. I'm chair of what's called PPG, Patient Participation Group in Highfield Surgery. And the question I wanted to ask was that, I've got an action plan and I'm developing that and implementing it and so on. And part of that is actually raising awareness within the local community about what PPG is about. But I'm very keen on networking, and the local pharmacies, Raj, is excellent. We work very closely together, and it's sort of quite collaborative working. And I'm very keen to actually extend this awareness raising thing. So I do session in the library, for example. So quite a few people come who are not members of Highfield Surgery. So I say, not to worry, you can actually look up your own PPG. And I'm trying to get sort of collaborative working with other PPGs in the locality. So we actually are working together to spread the word. So the question is how do you see the role of PPG in raising awareness, not only about what you've said today, but actually, the best way of putting it is that a lot of people just don't know what's going on. And it's actually doing it in a way which is incremental and constructive rather than bombarding people. So it's a sort of broad question, but I'll be interested to know what your view of.
Yeah, we've worked with other PPGs. We've worked with some in Reading and in West Berkshire. We're more than happy to come along and say a few words. Or perhaps we could get more than one PPG. We could do an evening online event like Healthwatch have organised today, and I could do exactly the same presentation. I know these days we've got lots of social media outlets, and we follow very, very many Facebook groups and whatever, and we see lots of both negative and positive comments about healthcare and pharmacies specifically. And sometimes it's lack of knowledge, isn't it? It's lack of understanding. So for example, if we get told, there's always queues outside pharmacy A, so we go and speak to the pharmacy. Actually, it's the general practice that's got an issue. They've got sickness and they're not working through the prescriptions quickly enough. And so there's a hold up there, or it could be that there's a run on antibiotics for some reason, and they're taking longer and longer to process some of the scripts. It's with many issues and many challenges that we try to help with and help understanding, I think, as well, which is quite important. But I'd love to, if you want to drop me a line, Bal, it's no problem at all.
That I really would welcome that. Thank you.
It's something to think about. We so together with the ICB, we have a regular networking event for PPG. So perhaps you can come along to one of those, David.
Yeah, happy to.
Carol. Hello, Carol.
Hi. Yes, there was some information there I didn't know about. I know about the Pharmacy First stuff, but have you got any documents that I can read and regurgitate for the newsletter I send out?
Well, I'm happy for the presentation to be shared as a PDF. But if you go to our website, cptv.org.uk, everything is there. You
Okay,
can.
well, that can be put in a chat or something.
I'll put it in the chat for you now. Yes, and I'll put my email address in there as well for Val. So.
Okay. Now, are you saying that the minor illness referrals can come from the 111 or from a GP?
Yes.
Okay, I didn't know that.
We get a lot more from 111 than we do from GPs. We've got a very good relationship with SCAS, who do the 111 service for us from Bicester. And what they do when people ring in or fill in the online form, there's almost like a triage thing, and they're trying to steer many more now to pharmacy, because they find when they refer to some GPs, they struggle to get patients to get a face-to-face appointment. So we're visiting pharmacies that have got the capacity to do 10-15 consultations a day, and they're getting one patient referred to them a day.
Okay.
So there is capacity.
Okay, so our GPs need to be made fully aware.
Yes, they are.
The other thing is, one of our pharmacies no longer sends text messages out when the prescriptions are ready, and that really
it costs them money, unfortunately. So it's a nice thing to do, and I'd welcome it anywhere, but obviously there's a cost to that service.
Yeah. I know patients are now moving pharmacies because of that reason, because they want to know when it's ready.
Well, what we're finding though is there's a facility on the NHS app now, I think, that you can they can get working to let you know that as well. So if you want to drop me a line with the name of the pharmacy, maybe I can contact them and help them understand they might want to reconsider their thought process if they don't want to continue to lose patients.
Yeah, I have spoken to the guy, but didn't get anywhere.
No problem. I can try and help you with that.
Can I ask another question?
Just raising.
Go on, Val.
I was fascinated with the economic and political framework, and I was aware of some of it, but actually I was really shocked to learn some of the figures and so on, like 7 pharmacies closing a week and so on. And I don't think it's going to get better for the next 2 years, I think, at least. And things are going to get, I think, worse before they get better. And I'm just trying to think about how we can actually, the word that comes to my head is educate people. The polite way of saying is make people aware. And quite often, when I talk to some patients, there's a lot of sort of blame game going on, sort of surgery doesn't do this and pharmacy doesn't do that. And my overall view is that I think it's really important to work collaboratively, so that there's one message going out. And I think that's going to take a while. A lot of the time when I talk to patients, they say, oh, surgery doesn't do this and surgery doesn't do that and so on. And I'm trying to say to them, look, there are more ways of getting through to the GP service than ringing at 8 o'clock on a Monday morning, and there's clinic and all sorts of things. So I think it's I see it as a journey with lots of stopping points and so on. And I'm just thinking, sort of working collaboratively with the local pharmacy, but also, we've got others in Boots is up the road and so on.
I think my number one message will be to support your local pharmacy. If you don't, if you don't use it, you'll lose it. It's, an old adage, but you will, because it's like, banks, post offices and everything else, they just disappear unless they're used, effectively. Things have got better in terms of the relationship between practice and pharmacy, and things like electronic prescriptions has helped enormously. When I was in pharmacies many years ago, everyone was on green scripts. We'd joke you have to play find the script sometimes because someone's put it in the wrong place or filed it wrong. With electronic prescriptions now, it's much safer, more efficient, it's quicker, but The weak point, of course, is the practice end where the doctor still has to digitally sign the script. So if they're not there, or there's a queue of scripts, it takes a while. Or at the pharmacy end, of course, if they haven't planned their day properly, or they've got too many patients walking in still with paper scripts, that's going to take away their workforce from doing all the planned work. And one of the small things we're asking practice to consider is something called electronic repeat dispensing. So if you're on the same 3 bits of medication month in, month out, they should set up a regular script with the pharmacy. As soon as you collect September's, October's appears. So they've got a whole month then to get October's ready, order the stock, prepare it, put it in a bag, put it on the shelf. So in a couple of weeks' time, when you come in, it's already done. And then when you collect that, it starts all over again. And they can set that up for 11 months at a time.
I think, David, well, the relation between Highfield surgery and local pharmacy is very good.
Yes.
And I think they're very good collaborative working and so on. But it's actually, you know what it's like. If 99 things might be right, but if there's one thing wrong, so the patient I've sort of come across, they don't see the bigger picture, so they start blame gaming. And actually,
and it's hard. It's hard in practices too. You know, the turnover of staff, receptionists, and care navigators, as some of them are called now, is quite high. Some of them are even looking at outsourcing that work to online platforms, which we haven't got a problem with. But then we need to make sure that the local pharmacy is still the pharmacy that you get referred to, rather than a remote one 100 miles away. So but the collaboration piece is, you're absolutely right, Bal, is really, really important. And, you know, Kevin, who works for me, has been in to see almost every practice now across the whole of Bob, and had that conversation and tried to build up relationships, offer training. We do get some resistance, if I'm being honest, but we get welcomed with open arms and a lovely cup of coffee in others, you know, so it does vary.
Right.
Could you tell us about the medical training that pharmacists?
It's quite intense, to be honest. I mean, like, as we said, we've got several schools of pharmacy around the country, and they're universities. They call them schools of pharmacy, is a bit of a collective term. But you know, each pharmacist goes through a 4-year degree, quite intense, and don't forget, it's very clinical from the get-go. It's obviously the science of how medicines work and how they interact with your body and with other medicines, but in terms of things like minor illness, they get exposed to examining patients from quite early on now in their degree, and they spend a whole year in a pharmacy with a pharmacist who's been selected out of, you know, it's only 10% of them can do it as a mentor, to go through some real hands-on training. And like I said in the presentation, each pharmacist and technician, who are slightly below a pharmacist, are registered with the GPHC, and they have a very, very strict code of conduct. They offer lots and lots of support and extra support and training as well. And with Pharmacy First, having to do ear examinations as part of one of the conditions is very new. So we facilitated the training of 450 pharmacists across our geographical patch, and they all had to buy an otoscope as well out of their own money to be able to do the test, to enable them, to give them the skills to make sure they're looking for the right things, for red flags, and then offering the right treatment. And believe it or not, in terms of Pharmacy First, they had to read and sign 150 pages of legal direction. They're called PGDs. There's 23 of them for each medicine that's given out at a Pharmacy First consultation. They have to sign a legal document promising only to give it to those patients that fulfill a certain criteria, only to offer a 5-day course for many of them, and fill in all the different governance and paperwork before they're even allowed near any patient. So it's a lot stricter than other professions, to be honest.
Thank you.
And just to add on, with Pharmacy First, while we're waiting for our new contract, we're hoping that the government will see fit to expand Pharmacy First. So we can do children for earache, we can't do adults. Don't know why, but it'd be easy to add adults because the training's already done. And we only do one skin condition. Well, if you're seen by a pharmacist because you've got a rash, you don't know what the condition is until there's been an examination. So we should be able to give out prescription strength medication for dermatitis, psoriasis, acne, whatever, you know, alongside impetigo. So we're looking for that expansion, but the caveat is, of course, that it's funded appropriately within the pot of money that the government will see fit to give us, hopefully very, very soon.
Thank you. And I think we are coming towards the end of our time. Has anyone got any final questions for David?
No, not final question, but just to say thank you very much, David. I really enjoyed listening to the presentation, but also I've learned quite a bit, and it's given me a few ideas about follow-up. So did I hear right that, you know, we'll have your email contact point?
I've put it in the chat. It's there now.
Okay, and I'm seeing Fiona anyway before long, so I'll work with Fiona and then do all the necessary. But I'm very keen to actually make people aware locally within Hazelmere area. So you'll be hearing from me.
Good, that's my job. And thank you once again to Fiona and Zoe for facilitating the webinar, and it's been great to meet so many of you here today. So thank you very much. Thanks for having me.
Thank you. Thank you, everybody. And if you would like a PDF copy of the presentation, then do let us know and we can send that to you.
That's great.
Okay. Thank you, everyone. And the recording will be on our website in a couple of weeks. Thank you.
Fantastic. Thank you. Bye-bye. Bye.
Bye. See you, Fiona.